Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Britton down in here with us this morning for his first visit here at Advanced Chiropractic Relief. And his friend who he works with brought him down here from Kentucky, right?
Yes.
And Britton had a discectomy done in 2009.
2020.
Excuse me, 2020. Yes, I got that here. I was reading your other thing down here. 2020, and he had severe sciatica all the way down his right lower extremity prior to that surgery, right?
Yes.
And you don't have so much of that anymore, but you still get bouts of pretty severe low back pain.
Correct. Yeah.
That'll debilitate you for a while.
Yes.
And he does have a little bit of permanent nerve damage down in that right leg down to the top of his foot. He feels some numbness and tingling there occasionally. Is that correct?
Correct. Yeah.
He gets upper thoracic spine up here in these traps areas gets sore and stiff. He has neck pain and stiffness occasionally, not a lot. He has occasional headaches as well. And he gets some paresthesia in his left hand, all the fingers down in his left hand. So that's C6, 7, and 8. And he doesn't have any contraindications to getting these procedures done. He doesn't have any loss of bladder malfunction, nor does he have any pathological conditions that would prevent him from getting this technique. He was a little nervous coming in this morning about getting his first ring dinger, huh?
Just a little.
Yeah. But we take all that fear away pretty quickly.
I hope.
Once I ring your bell, you'll be fine. Let's show him your posture first, Britton. I'm going to have you close your eyes and bend your head forward and backwards again. And then back to neutral. Now his head's forward in the Z-axis. His ear's out here over his clavicle. It should be back here over his shoulder. That's why both shoulders are rounding forward and his hands are riding out front of him. A little bit, not a whole lot actually. His head's translated to the left and tilted to the left, so that's probably his sleeping pattern. He's got a little left translation of his pelvis on the x-axis. And since this is Britton's first adjustment here, I always do the BioPhysics first on a new patient, just so I can get a feel of their joint range of motion and tissue hypertonicity or tonicity. His right leg's about 1/4 of an inch shorter in this prone position. However, this is an interesting finding. When I bring it up, it actually gets about 1/2 inch shorter, almost 3/4 of an inch shorter, and that tightens up in his lumbar spine and his thighs. And come up here and palpate his pelvis. He has a little tenderness on his right SI joint there, and a little bit right there on the sacrum on the left. Here's his scar right here from the back surgery. He's got tightness and flattening out of the lumbar spine. He's got multiple thoracic spine and ribcage subluxations, upper thoracic subluxations. C5, C6 is on the left, C3, 4 is on the right. So I'm going to start off adjusting his pelvis. He had a right sacral deviation test too, so I'm going to start off with that. You're going to feel the table moving underneath of you, Britton. There, he might be a little sore at first, Britton, just because they've been out for a while. It's not going to hurt your surgery site, though. Yep. Yep. Making me work for him this morning, huh?
I could feel those.
Yeah, I know you could. So could I. Looky there already. It's even, and looky there, it stays even. So that's pre and post evidence that we corrected his sacral subluxation. Slide down this way about an inch. There. Yep. Yes, sir. Okay, let's turn you on your back, please. slide down about another inch. And bring his whole head up and backwards, which will help get his head up over his spine properly. Now put both arms out like this for me, Brendan. Palms facing up. Slide down this way about another inch, please. There you go. Alright, come on, table. It's adjusting to your body weight.
The one at home.
Getting there. There it is. There. The what's that now?
The one at home had to get a part for his table because of where I'm big.
You broke his table, huh?
No, it was to accommodate.
Oh.
He wouldn't let me on it first.
Oh, wow. We've actually treated guys that are bigger than you on these tables, so I know it can handle it. There we go. Okay, you can relax your hands right there now. Let this right leg go like a limp rag in my hand now, Brenton. Let go. Breathe. There we go. Yes, sir.
Whoa.
You should have felt that from your knee all the way up to your low back.
I felt it in my low back for sure.
Good. Let me have this one too. There it is. Okay. Let's set you up. Face that way. You okay?
Yeah.
I'm just getting started. Saving the good stuff for last. Okay, let go. You have a hard time letting go, huh?
Yeah.
You
I get a
control
little.
freak?
No, not at all.
Maybe we better ask Casey. There we go. Yep. Okay, let's come over on this table next. I'm gonna have you lay on this table on your back with your butt on this pad.
This way.
Head up this way. Scoot down this way. There you go. Okay. Just let your legs relax now, Brittany. We're gonna lift them up with this table.
As many times I've been on a decompression table, whenever you pulled my legs, I've
Got
never,
more movement.
I've never felt it.
Yeah. You're fixing to feel a whole new sensation. Maybe slide down about half an inch. There you go. Okay, this is gonna feel really tight, Brenton. It's supposed to. Not gonna get away now.
Couldn't if I wanted to.
Okay. I'm gonna put this wet towel around your base of your skull and your mandible. And I'm gonna decompress your entire spine. Lift your head up for me. Lay back. On this one, you just want to keep your teeth together, Britton. Don't bite your tongue. Breathe through your nose for me. Will your left ear? Yes, sir.
Oh.
Yep. How far down did you feel that one?
Right in here.
Okay. Double dinger, first thing in the morning. And your first one's a double dinger. Wow. Let me get a better martial arts stance here. Yes, sir. You should have felt that one a little lower.
All the way.
Okay, good. There. Good answer, because I was going to do a triple dinger on you if you didn't. You're still kicking. Look at the difference in this right reflex compared to over there. Did you see that improved?
Well, I
Jump
felt it
more.
actually move.
Yeah, exactly. Tilt left. Let me have you. There you go.
I have a hard time with that, don't I?
No, that wasn't that bad. You lived through it all. You're still talking. Wasn't that much to be scared of, was it?
I was scared to death. Ask him.
Oh, I believe you. We have a lot of people who get scared, but once they get it done, this is heaven. You should feel a little lighter right now.
Feel a lot better.
Yep, imagine that. I'm gonna use this instrument to bounce the muscles here. Just keep breathing. Yeah, okay. Now I'm gonna show you your homework. Your head's forward, pulling your shoulders forward. So pull both shoulders up and back. Up. Shrug them up. And then back this way. Flare these hands, palms forward that way. We're gonna bring that head straight back this way. And then look backwards. You're gonna feel a little tap on your atlas there. And there, now relax. Try that forward and backwards again, see if this feels any smoother yet.
Definitely feels smoother going backwards.
Yes, sir. Take a look at your posture right now.
It's a lot straighter.
A lot straighter. See how your shoulders squared off?
I can take this, I feel a lot better.
So how would you describe the difference in what you received here at our office today from what you used to see from your chiro?
It's a lot faster relief. Everything I've experienced in the past was more of a slow, a lot more steps to the treatment to get to where we
Had to
just
go
got.
3 times a week rather than just once or twice, huh?
Well, 4
Yeah,
to
4 or
5.
5.
If he was open 5, I was there 5.
Wow.
The decompression that I've went through, probably went through about 40 times on a table.
40, those decompression table
Yeah.
visits.
Yeah,
Did
that
help?
and then an adjustment every time plus the TENS unit before. It did help, but it was the long way around the pond, I feel like.
Yeah. Wasn't anything like this though, was it?
No, never was a pop or anything like
Yeah.
that. Basically, you would lay on it for 20 minutes and you would feel good until it put you back together,
Mm-hmm.
but it took way too long.
That's what a lot of chiropractors call decompression therapy. Really, it's a glorified traction machine. This is an actual chiropractic adjustment on the y-axis, so it's different than decompression tables do. I locked your pelvis in there and got a good fulcrum in.
I've watched probably 40 of your videos. I was afraid to get on that, but I'm not afraid now.
No, that's right. Good. Well, thank you for sharing your first experience with everyone today, Britton.
Thank you for doing it.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Britton from Kentucky. We'll see y'all soon.